As a scientist, I also believe that what is also becoming very evident in our city of Bengaluru, is the fact that we have a lot of growing interest in the science of neurological diseases, neurological mechanisms. Brain research is becoming a very, very important part of this scientific ecosystem, and I'm really pleased that there is this growing collaboration between NIMHANS, the National Center for Biological Sciences, the Indian Institute of Science, and people like Chris Gopalakrishnan have even philanthropically contributed to creating a brain research center. And I think there's been a lot of work done by NIMHANS. I know that this whole area of schizophrenia and many other neurological diseases, not just mental health, but other neurodegenerative diseases, Fragile X syndromes and many other kind of rare diseases have also been researched in a big way. And as a scientist, I believe we as a city, we as a community, we as a scientific ecosystem must really start excelling in understanding mental health much better at a scientific level, at a cellular level, and really see how we can really make a big difference to this whole area of mental health. I am basically leading a strong initiative to see how we can attract both CSR and philanthropy in supporting a lot of research, because we need to research this area. It is such a difficult area to research because, as I said, people don't want to talk about it. People don't even want to become research subjects. But I think by creating this growing awareness that such diseases, such states of mental health can be actually addressed and cured is very, very important. And I think we as a city have a very unique opportunity of excelling and creating a center of scientific research, excellence in scientific research and psychiatric research, which I think can really put us into a very different league. Because I think there's much to be done, much to be researched, much to be addressed, and it's a daunting challenge. So I must congratulate Susmita, because like Dr. Bhide said, once you start reading, it's a very easy read because you can relate to every character. You can sort of almost imagine that, my God, this could happen to any of us. We know people like this. And she's written it in such an easy to read way that you relate to every one of those people she's talked about. Whether it is Aditya, the psychiatrist, whether that young boy Raj, or his mother Deepa, or his own wife Prachi, and what she feels about this whole area of psychiatry. I think she's done it very well. And more than anything else, it also gives you an idea and a way to glimpse into the lives of these people. These are normal people but desperate people. They need help. And they need to be, you need to have that sensitivity and that understanding to basically sit with them and ask them what it's all about. And it is a very, it's not just about medication. I think psychological counseling has a lot more to do. That humanitarian patient listening to these people is a much more important part of that therapy than just the drug or the medicine. So I really want to congratulate Susmita for really bringing this focus and this awareness through a simple book that anyone can read and realize that it's very, very important for all of us to understand what this whole disease, this mental health. I mean, if you think about it, we ourselves have multiple breakdowns when we talk about stress. That's one, aspect of understanding mental health. I mean, we all get very stressed in our lives every day. And it's just one minute way of saying, well, it's about that as well. So I think it's very important for all of us to understand what mental health is all about. We must keep mentally very healthy. That's the message I really want to give. And we can keep ourselves mentally very, very healthy, very alert if we really, really understand what causes imbalance in the way we think, the way we behave, the way we deal with day to day life's problems.